Hello and welcome to this clinical skills tutorial about examination of the placenta. Preparation for examination of the placenta involves explaining the procedure to the parents. You should ask them if they want to observe the examination, and you should also ask them if they wanted to take their placenta home. You will need informed consent for the retention of samples, and you should also gather the necessary equipment. You will need a disposable bag for the placenta, a weighing scales, a specimen jar, and some scissors. Your selection of personal protective equipment, or PPE, should be based on an individualized assessment of the woman's situation. You will at least need an apron, goggles, and some gloves. First of all, you should wash your hands, apply an apron, your gloves, and your goggles. You should lay the placenta down with the fetal side uppermost. You should note the size, shape, smell, and colour. You should also observe for irregularities on the fetal side. You should now examine the cord and note the length, the insertion point, and the presence of knots. In the cut end of the cord, you should check that there are 2 arteries and 1 vein. Next, you should turn the placenta over so the maternal side is exposed, and examine to ensure that all the cotyledons are present. You should also note any blood clots or areas of infarction. You should retain any blood clots and measure them and add the estimated blood loss. Next, you should lift up the placenta by the cord at the insertion site with your non-dominant hand, and with your other hand examine the membranes for completeness. Next, you should spread out the membranes and examine for any holes or any vessels that might lead you to believe that there is a lobe of the placenta missing. Next, you should separate the chorion and the amnion up as far as the base of the cord. Now that you have examined your placenta, you will start taking the samples. First of all, you will take a sample of the cord. You should also take a sample of the cotyledons from the maternal side of the placenta. Using your scissors, you should take a sample from the center of the maternal side, and also a sample of the chorion and the amnion. You should then place your 3 samples in your specimen jar and apply an addressograph label. Place the placenta in a disposable bag and weigh it. In some cases, a placental swab is required, for example if there had been a pyrexia in labour. To do this, you take your swab and use a zigzag motion across the fetal surface of the placenta to obtain your swab sample. In some cases, the complete placenta should be sent to the lab. However, it is still important that the midwife checks the placenta for completeness before sending down to the lab. Now that you have completed the examination of the placenta, you should dispose of it according to hospital policy. You should also dispose of the equipment that you used to examine the placenta. Now you can remove your PPE and wash your hands. Discuss the findings with the parents and also document in the maternity chart. If you noted any abnormalities or anything that was missing from the placenta, or if it didn't look like it was complete, this should be reported because action may need to be taken to prevent any complications. You have now come to the end of this clinical skills video. You should review your lecture notes and also refer to your core midwifery textbook. When examining the placenta, taking samples and sending the samples to the lab, you should always refer to local hospital policy. Bye for now.